May is Mental Health Awareness Month, and this has been an especially tough May for farmers around the region. Here to visit about that is Shauna Reitmeier. She is CEO of the Northwest Mental Health Center. And very important topic here, mental health among farmers, suicide rates among farmers. What are we seeing for trends?
Well, I think just some recent data, we're seeing a higher trend in suicides in the ag industry. When we look at all industries, the ag community is higher.
Talk about why there's so many more risk factors for the farming community.
Well, when we look at the risk factors of people at risk of dying by suicide, farming and ag communities have many of those risk factors just inherent in what they do, such as being isolated in vast distances away from other people, so you don't have as much social connection with neighbors or with people nearby. Being in ag areas, there's also less access to healthcare services as well. So for somebody that is trying to reach out for help, there isn't as much available for them. And then one of the other, I think, big factors as well is that having means to lethal means to access for people to actually complete and die by suicide is greater in those areas. So they have higher risk factors.
So what are some of the protective factors, though? Can you talk about those?
Well, I talk about protective factors as almost that force field that we put around ourselves. And the stronger that force field is, those risk factors get to bounce off of that person. And so when people do have strong family networks and have good connections with their neighbors of whoever's around them, that they're healthy, that they have good purpose in life, that they are involved in cultural or spiritual practices that are really rooted in their day-to-day work that they do every day, just builds that force field. But the connectedness to people is really the strongest. So the more people that are surrounding a person, there's more people that are able to see if something isn't going well for that person, and so that's really important for them.
So talk about those people within your network. What are some of the warning signs? What should they be looking for?
Well, that's a great question, Michelle. I think of if you're a friend or a neighbor or a loved one that walks or drives into somebody's yard, onto the farm, and it's not like the normal time where you might be in the middle of calving or you might be, pushing to try to get your crops in the field before the rain, and somebody is looking really disheveled, isn't taking care of themselves. You might be waking them up in the middle of the day, and they've been sleeping. That the farm itself, the maintenance of the farm is maybe not being kept up like they normally would. Those are some signs that I'd say, one, are they struggling with some mental health stuff? Do they have financial issues that they're not able to maintain, their farm? Because then those are risk factors as well for people to be at risk for suicide.
You grew up on the farm just like I did, so farmers are very private people. So how do we get them to talk about it?
Well, I think it comes to people like us or friends or family to actually start broaching the conversation. And I talk about how do we move from fear of talking about mental health or even suicide and move into courage. And I know sometimes that's easier said than done. But I like to say that I would rather ask the question if somebody has been thinking about suicide, because I might be able to help prevent somebody, than wake up the next day and get a phone call that somebody I was concerned about did die by suicide. And so the more we talk about it and ask our loved ones, I think it starts normalizing and making it okay to talk about mental health and to ask that question if somebody is concerned about suicide.
So resources, what's available?
Well, I think you really need to look at where do you live and what are some of the mental health agencies in your community, because each area is very different. But I think we'll be posting some hotlines that are able across the nation that people can be calling and asking and getting some support and help. And many of those hotlines have resources directly in your community. But I think start with your doctor. start with your, if you're really involved in your church or your faith-based community, you could start talking to your pastor or your minister, are great places to start, or talk to your loved one that's nearby. Start where you're more comfortable, but there are other resources within communities usually that are able to help.
Thanks so much. This is such an important topic.
You
we
bet.
appreciate your time. Shauna Reitmeier joining us, and she is CEO of the Northwest Mental Health Center.